Perfect. Yeah, I hope it's pretty obvious that I'm not Timothee Aubourg. He has escaped to an academic conference, so I'm going to be giving his talk instead. And this is on new digital tools to support research in Parkinson's disease motor progression, specifically focused on a data-driven approach. So at the OPDC, we think that the use of smartphone applications like the OPDC/New Health smartphone application can significantly help researchers in studying motor progression over time. Notably, we know that there are two key advantages to using smartphone data for studying motor progression, and these are objectiveness and also the frequency of data collection. Specifically in regards to the data objectiveness, the smartphone sensors which are used in the app offer the opportunity to provide objective data of motor activity. So such information can be used in collaboration with traditional clinical assessments, which we know are subject to inter-rater variability. Then regarding the data collection, smartphones allow for data to be collected in natural living environments, and the information provided through the New Health app can give us a more frequent and accurate picture of motor progression over time. So with these opportunities also come specific challenges. Perhaps the most obvious one is related to the amount of data. So essentially when you're using smartphones, the amount of data you collect can kind of grow unbounded. And obviously we like to talk about having more data, but this also makes the analysis more complex. Actually, we have to focus on extracting meaningful insights from the larger data sets, which also integrate the original sources of information. In particular, in studying motor progression, we know that we have to place an importance on disease stratification, as well as subgroups within the data, which should be carefully considered within our analysis. Now, with the rise of digital technologies such as smartphones in clinical studies, there's a growing need to ensure that the new data that we do collect is not just objective, but also relevant enough to detect both broad and subtle changes in motor function. Now, there's no real magic solution to address this challenge. However, here at the OPDC, we think that this situation should push us to adopt a more responsible approach in the data analysis. So to this end, we have started to develop a prototype for a research platform, which is designed to facilitate the study of motor progression in Parkinson's disease, integrating both clinical data and the data from the smartphone app. So at this stage, we want the platform to help data scientists in their investigation of their data set during the data exploration phase, specifically focusing on two different aspects of this. Number one being the data description, and number two being identifying Parkinson's disease motor progression trajectories. So why do we think that this is important? Well, with the advent of new digital tools, it's important to support researchers in designing studies based on a relevant data set and also by analyzing the relevant parameters. So moving on to the data description part of this platform. So with this, with this part that we're developing, it basically allows us to automatically provide research scientists with statistical summaries and comparisons of their cohort data. Specifically with a focus on the clinical motor score, which is the UPDRS Part 3. And this is alongside other contextual information such as the demographics. So in the middle plot here, you can see the histograms of participants who are on or off medication, In the bottom plot, you can see participants within different visits split based on their gender. Now moving on to the trajectory identification aspect. So this should allow researchers to easily visualize and explore distinct possible motor progression trajectories over time. This should help us to distinguish between progression rates or abnormal patterns of motor decline among the cohort. So on the left here you have the UPDRS scores across all visits. This is for the exenatide study. And on the right you have the clusters of trajectories from the same data which Timothee has extracted. So as you can see, there are some which have much faster progression and some which are quite stable. The use of a platform here should really allow researchers to be able to interactively share their results with other researchers or also clinicians, and then refine their analysis based on the feedback that they receive. So for instance, we can imagine comparing these data-driven trajectories that we've automatically estimated on the platform with expert clinical knowledge, as well as the stats that we saw from the previous data description section. With this work, it's currently being implemented in a cohort of about 100 Parkinson's disease patients, which were followed over a period of 2 years, and that's the exenatide study. At this stage, only their general clinical motor score, so the UPDRS Part 3, has been integrated along with metadata and demographics. However, our immediate next action will be to integrate specific components of the clinical score. So the UPDRS Part 3 is split into different sections based on tremor, balance, gait, to give us a deeper understanding of the disease trajectories over time. From that next step, we're going to, at the end of 2024, also integrate the smartphone data for these individual components that I spoke about, which will allow for the comparison between the smartphone-based assessments and the clinical counterparts. This will ensure more comprehensive and accurate tracking of motor progression over time. We'll then be able to open the platform up to new and larger cohorts, such as the discovery cohort, to assess the relevance of this approach. Thank you.